Sure. I think one of a success story with CareLineLive, the one that I am very fond of, is a implementation of CareLineLive with an NHS trust. Actually, it happened to be our first NHS organization that implemented CareLineLive. This is the Mid and South Essex NHS Trust, and they approached us to want to try and implement our software to help them with hospital discharges and to try and digitize the allocation, the rotoing of carers to people that are being discharged from hospitals. They've been really, really successful using CareLineLive for that. And what it's resulted in is a couple of things. One is that they've succeeded in decreasing the number of beds that are taken up in hospitals, making faster for discharges to happen and therefore freeing up beds for other patients. But also they've managed to increase the size of their home care provision without increasing their overheads too much. So it's been a fantastic case study there. So another customer that has implemented CareLineLive very successfully is a company in the Northeast, I believe, called Crescent Home Care. They're quite a large provider. They have 70 carers. And before they decided to implement CareLineLive, they were paper-based. I think that means that they were using spreadsheets and word processors to help them record keep and manage their processes. They have been absolutely overwhelmed with how CareLineLive has helped them digitize their workflows and record keeping. And before they started using CareLineLive, they had an outstanding rating, and they've maintained their outstanding rating at the same time as increasing their business. They have essentially managed to expand their services and keep their outstanding rating by using our tool. Another customer that has implemented CareLineLive that has had a very successful outcome is a NHS trust in Northern Ireland called the Southeastern Trust. Northern Ireland has 7, I believe, NHS trusts, and this was the first trust to start digitizing their rostering for their in-house home care provision. And one of the main things they've achieved is increasing the capacity of their service, but by using their staff more efficiently. This has happened largely because after using CareLineLive, they were able to analyze the actual times that visits were taking and then adjust the planned times accordingly. And what they've discovered is that they can fit much more work within an existing shift than they were before. And they're absolutely ecstatic about that. And also, they've saved oodles of pounds not posting rotas to their carers to get their rotas. So it's been amazing. The surprising thing that they found was that their staff on the field, the carers, have absolutely found no problem using CareLineLive's mobile app. They've found it really intuitive. They were really scared and concerned that it's largely an older workforce, and they were very scared that they would be hesitant to use technology. But our mobile app is so intuitive, so easy to use, that actually they've had no problems at all. And now, carers have mentioned that they didn't know why they hadn't started using technology like this before. And carers have now made comments about why technology like CareLineLive wasn't rolled out much earlier.